Hello, my name is Nameko Monica Dupong, a student at Liberty University. This presentation is showcase the end of my practicum, a project done in Eswatini in collaboration with Give Hope Fight Poverty. My project was to assess the need of clean water and storage for the children in living with HIV and orphan. Background is Eswatini is one of the country with a high rate of HIV, and it mostly affects adults between the age of 15 and 49 years old. Due to the HIV prevalence of deaths, most of household parents tend to die earlier and leaving their children alone to fend for themselves, and they end up raising themselves with and their siblings, and they face a lot of hardships such as social and economic challenges, as well as the burden of being the caretaker of their siblings. My project being to find a better way to access water, a clean access water and storage for the children, is to alleviate their life and make it easier for them to go to school and fend for themselves. Knowing that water is a clean and safe and an essential component of hydration, medication compliance, hygiene, nutrition, and school attendance. The lack of reliable water increases the risk of diarrhea and waterborne diseases and may disrupt the therapy of children who are already high risk of HIV or who already have HIV. The following. My study objective were evaluating how family and institution within two rural areas in Eswatini coordinates the supply of water to the orphan and children with HIV. He also assessed it in terms of access, the cost, storage, and treatment, and the daily experience of the participants. The question is to seek easy and cost-effective solution to increase water safety, health, and education. Next page. The method used during this project was a mixed method cross-sectional field study. Basically, I gathered data through the survey, a semi-structured interview, and observational field notes. My assessment was done in two different schools, primary school and preschool of Elangeni in a region of Hoho, and also done in a community of Malinza, especially in a region of Lubumbo. The focus on the project was to gather the water source distance, the container capacity, the treatment practices, the household income, and the caregiver context. The key finding about the water access is the elementary schools and the primary school, they have the water catchment systems, the rainwater catchment system available to them during rainy season, but during the dry season it runs out, so they rely mostly on the river. And the students have mentioned that they walks from about 15 to 30 minutes to home to get water from the river during the dry season, and during the rainy season most of them have the barrel that provide them with a rain catchment system. And due to the fact that they spend a lot of time fetching for water, they end up being late at school, and some end up dropping at school, and most girls have to even cook at school to feed themselves. The key finding about the storage and treatment as such, the household primarily rely on the 50-liter barrels, which require multiple refills. This added to the amount of time spending to the refill point. And all households can actually boil water for disinfection, but due to the limited income and the low job availability, they don't boil water and they cannot afford to even boil water and just use the untreated water from the rain catchment system or just from the river. And an interview has proven that they only allow the water to sediment by itself. They let it stand for 30 minutes and they just drink water straight from there. As a result, from them going back and forth and fetching for water, they have a lot of barrel which allow them to storage water for a couple days. And due to the water standing there and untreated water, the wear on barrel increases even the potential of contaminations. The next page showcases a graph showing the distance children walk to collect water and the household water treatment practice, and as well as the distribution of water storage capacity in households. On following is showing the photojournalism of the field's observation during Eswatini, as well as a Google Drive link that showcases all of the photojournalism put together. On the top left, it shows the children getting water from a pipe, and the pipe is linked with the rainwater catch system that was built by the king of Eswatini. And on the top middle and as well as the top right, we have the rain catch water system that was done by the family household. And it just showcases how they collect the water for the family users. On the bottom left, we show multiple barrels around a pipe, as well as the bottom right also showcase barrels with a pipe, which show how the waters are being stored. The middle down is showing a river, and we can see water is not, it doesn't look clear because it was a rainy season, and this is how the community and the children live or survive. They use this water for their daily life. At the end of this project, I've come to a multiple recommendation. In the short term would be to promote the use of the clothes filtration, because the kids use the water down from the river. It's important that they filter the water for any kind of debris, and also use of aluminum sulfates for the cloudy river. It does allow for the sedimentation and clear water a little bit better. Then the use of iodine or chlorination for the disinfection that kills the bacteria and germ and lead to a potential healthy, safe water. In a mid-range objective will be the expansion of rainwater collection in school and community places. And the long-term objective will be the use of community-based micro-water grouping to substitute the expensive central water, especially prioritizing the homestead of orphan and the children living with HIV. At the end, a health promotion will be recommended in a school setting, since the kids mostly go to school, and with the help of the teachers to promote the use of filtration, chlorination, and aluminum to get to a clean water and a safe one for a better health. This is the end of my project, and this is the end of the presentation, and thank you for listening to me.